Hello, everybody. My name is Dr. Snehasis Ghosh. I am an assistant professor in the Department of General Medicine under WBMES. Today, we will talk about a few things about understanding the cholesterol management. So, first of all, what is cholesterol? It is a very important component of our body, which is very predominantly present in our blood, cells, and body tissues. So, and also it is important for production of the hormones and bile acids and vitamin D. So in our body, cholesterol should be healthy, but too much cholesterol can produce an harmful effect to our health. Normally, body produces its own cholesterol, and also we take cholesterol from food, which is known as dietary cholesterol. So cholesterol is normally fatty in nature, and so it cannot be dissolved in blood. So it is what we get is a packaging of cholesterol, which is covered by protein component. Cumulatively, it is known as lipoprotein. Normally, there are two types of major types of lipoprotein present in our blood circulation. One is low density lipoprotein. Another one is high density lipoprotein. So low density lipoprotein, which is predominant in blood circulation, is also called as bad cholesterol. Why? Because it transports the cholesterol or fatty component from the liver to the peripheral cells or peripheral parts of our body through the blood circulation. An excess amount of the low density lipoprotein gets deposited in the walls of the blood vessels, which is called as atherosclerosis. Therefore, it causes thickening of the blood circulation, blood cells or blood vessels, and increases the peripheral vascular resistance. Therefore, increases the blood pressure. So increased blood pressure means increased cardiovascular risk factor. Therefore, we will have increased risk for heart, kidney diseases as well as stroke. So low density lipoprotein component of blood should be as low as possible. Next is high density lipoprotein or HDL, which is also called as good cholesterol. It is good or healthy because it scavenges the blood cholesterol from the peripheral circulation or the tissues into the liver, and it scavenges or reduces the total amount of the cholesterol from in our body. And also another form of fat that we have in our circulation and body is triglyceride. Body also produces triglyceride on its own, and through the dietary sources we also intake some amount of triglycerides. So high cholesterol usually has very few or very negligible sign symptoms. What we get or what we find is through a blood test or blood panel, which is called as lipid profile, that we do regularly. And in the blood profile or lipid panel, we get four components, commonly four components is total cholesterol, HDL, LDL, and triglyceride. Total cholesterol in the form of total LDL, HDL, and triglyceride, and individual components also in HDL, LDL, and TG. Normally, as per norm, the total cholesterol should be in an healthy individual is less than 200 mg/%. The HDL should be more than equal to 60 mg/%, and LDL should be less than 100 mg/%, and triglyceride more or less should be less than 150 mg/% to maintain a healthy cholesterol scale in our body. If the total cholesterol or the bad cholesterol component gets increased, then it should be managed properly. First by dietary modification, followed by dietary lifestyle changes, and nextly or lastly through the medications that we prescribe regularly. So what are the drug treatments or drugs available in our kitty? One is, our first component is the statins, which is the first line management or first line drugs that we use, which is very safe and commonly used as a monotherapy or a combined therapy for the treatment of high cholesterol. It mainly helps in lowering down of the low density lipoprotein or bad cholesterol in our body. Secondly, fibric acid or fibrates. It predominantly is used to reduce the triglyceride level and to some extent lowers down the low density lipoprotein level in high risk individuals. It can be also used as monotherapy or in combination with statins. Next is cholesterol absorption inhibitors. Predominantly, these drugs works in jejunum by reducing the absorption of the cholesterol from the gut, thereby decreasing the total cholesterol level. For example, ezetimibe that we commonly used. Next is nicotinic acid. Can be used to lower the low density lipoprotein and triglyceride and increase the HDL level in our body. And finally, bile acid sequestrants like cholestyramine or cholesterol. These drugs, they sequestrate bile acid, thereby reducing the total cholesterol absorption and decreases the total cholesterol level in circulation. So regular or timely intake of these cholesterol reducing drugs as well as healthy lifestyle can maintain the total cholesterol level of our body in control. Next is, apart from the drug treatment, what we have or most common component of this management of the cholesterol level is healthy lifestyle or healthy living. What are the component of this? Component of this healthy living are healthy eating. That is, what we eat is has a major effect in our cholesterol level. So healthy eating means the component that we eat should be limited in saturated fat component. For example, the processed food or cheese or fatty meats, we should limit these components in our food. We should choose foods that are high in unsaturated fat and low in saturated fat component, low in trans fat, low sodium, as well as added sugar component. For example, lean meat, seafood, or other components like nuts and vegetable oils. These are healthy and these will help in increasing the HDL level as well as decrease the low density lipoprotein level in our body. And food naturally high in dietary fiber component. For example, whole grains, oatmeals, green leafy vegetables also help in scavenging out of the bad cholesterol from our body. So this healthy living or healthy eating component is also very important. Nextly, physical activity. Physical activity in the form of brisk work. For example, brisk walking, brisk cycling, dancing, swimming, etc. These components help in, or these things help in reducing the low density lipoprotein or bad cholesterol in our body. About 150 minutes of aerobic work in a week can help in reduction of significant amount of cholesterol in our body. Next is smoking. Smoking individually is a risk factor for our cardiovascular system, apart from its higher ability of increasing the low density lipoprotein level. So smoking reduction or quitting the smoking habit helps in the reduction of cardiovascular risk factor as well as reducing the total cholesterol level. Next is losing weight. The obese individual or overweight persons, if they can lose their weight by dietary restriction as well as exercise, can help in significant reduction of total body mass as well as total body cholesterol level. Next is stress management. In today's life, management of stress is very important, as high stress in our working life can increase the blood cholesterol level in the form of elevated LDL, triglyceride also. And adequate sleep, about 7 to 9 hours of sleep per day is essential as a norm, because sleep helps in repair of our blood vessels and heart also. Therefore, adequate sleep is also important for reduction of the cholesterol level in our body. So in summary, high cholesterol or high blood cholesterol is the major controllable risk factor for heart disease, acute myocardial infarction, as well as stroke. We should have steps, or we should take steps daily to reduce the total cholesterol level in our body, no matter what our age is. And the total cholesterol or lipid profile can be managed through three things. One is healthy living, that is maintaining a healthy lifestyle by adequate dietary restriction, therefore reduction of the total body cholesterol and body mass. Next, healthy eating, followed by regular physical exercise, and lastly, medications. If we need, we should take the medications regularly and also properly follow up and properly contact the health team regularly so as to maintain the cholesterol level adequate in our body. Thank you.